Hello and welcome to today's session titled Accountability Skills for the Exceptional Patient Experience. I'd like to introduce our presenter, Ms. Wendy Leebov from the Language of Caring. Ms. Leebov is an author, thought leader, and expert on improving the patient experience. We'd also love to hear any of your questions. Ms. Leebov will take time to answer them later on. A recorded version of this webinar will be available within the next 2 to 3 days. Again, welcome to the Accountability Skills for the Exceptional Patient Experience webinar.
Hello there. Welcome. My name is Wendy Leebov, and I appreciate this opportunity to talk with you.
To achieve an unparalleled patient experience and a culture of caring through exceptional communication. Now, in many healthcare organizations, at least in the States, people complain that there's no accountability, that the people at the top don't hold people accountable. Some people feel we went to all this trouble producing standards, but they sit on the shelf. There's no accountability. Some people feel the same people misbehave that always did. They get away with misbehaving, and it just isn't fair. Some people feel there isn't accountability, so their strategies to make improvement do not have credibility and they do not last. Common situation, people invest time and money in change initiatives. They generate hope that things will be improving. They implement powerful practices and they're focused, employees are engaged, and improvement does occur, but then people let the ball drop. There is not willingness to hold people accountable as people shift to other priorities and other initiatives. There might be people coming in with new ideas, or people get busy and they make excuses. They lose their focus, and when they allow accountability to fade, they have wasted money, they've wasted people's time, and they've created cynicism and resentment. Quick example, in the United States, nurses are expected to do hourly rounds on patients to stop in and ask how they're feeling, whether they need to go to the bathroom, whether they're feeling pain, and have a conversation and help them in any way that they can. But when accountability is missing, the way this happens is that the nurse knocks on the door, pokes his or her head into the room and says, "Need anything?" and then is quick to rush away. Now that is not effective hourly rounding. But if their manager permits them to do rounding in that way, then of course they're not going to get the powerful results you get when you regularly stop in on patients. There are certain forces that have to be aligned in order to create a culture of accountability. And those forces, senior management needs to be focused and committed. Leaders need to act as role models, practicing what they preach. You need clear values and standards. The human resource practices need to be aligned to advance the great patient experience. Job descriptions and job-specific expectations need to set a high bar so that people know how they're expected to behave and are held accountable for that. And the hiring process needs to screen for caring communicators. Now, just in terms of human resource practices, getting specific, these practices need to be aligned to create a culture of accountability. New employee orientation needs to get people off on the right foot right from the first day, making it clear what the behavior they're expected to do. Their managers and supervisors need to provide ongoing feedback and coaching. The reward and recognition programs need to focus on employee behavior, not just how long they've worked in the organization. The performance reviews need to focus on service performance, not only people's technical skills. And there needs to be a progressive discipline system so that people are coached and counseled. And if the coaching and counseling is not helpful, then their employment needs to be terminated so that they don't lower the standards for everyone. So the accountability question, as far as I'm concerned, is how do we raise the bar on performance? How do we raise the standards? And I just want to say that we have to stop the erosion of our standards that occurs when we tolerate violations, but that's not actually enough. We also have to establish higher standards that will move us from good to consistently great and build a culture of accountability. Raising the bar and holding people accountable is not the same as eliminating negative behavior. Eliminating negative behavior gets people to the middle of this behavior continuum, where patients and families are indifferent. They're not impressed, but they're not angry. And that is not a high enough standard for healthcare, where we are there to serve people who are sick and vulnerable. We need to set behavior standards that are up at the 5 that will make we're not talking about just getting rid of negative behavior. We're talking about replacing negative and also mediocre behavior with really impressive, caring, therapeutic behavior. So our goal is to raise the bar for everybody, and we need to be clear about our expectations, communicate high expectations, coach for exceptional performance, and give people action options. And I'm talking about consistently, every interaction, every day. Now, holding people accountable is tough. Many people don't like conflict. What it takes to hold people accountable is a combination of backbone and heart. Now, look at this continuum of behavior. On the left are unacceptable behaviors. These are not permitted. Then on the far right are acceptable behaviors. They're great behaviors or they're good enough behaviors. And then there's a gray area, so-so behavior. It might be negative behavior, but it happens rarely, or it might be inoffensive but not impressive behavior, or it might be unacceptable behavior you tolerate because you're afraid of what will happen if you don't, like you might lose the employee. It's behavior that's become normalized and accepted, but it really isn't great behavior. Now, in the middle column, think about what kinds of behaviors are in there. These are the behaviors that make you lose sleep at night. They give you mixed feelings, and it's frustrating. So, for example, occasional rudeness. Now, if somebody's mostly a good employee but occasionally rude, some of us as managers aren't sure whether to intervene and try to do anything about it. We might think to ourselves, hey, nobody's perfect, so I'll let this pass. But that person's moment of rude behavior might be a big part of the patient's overall experience. So we can't let things pass. We need to tackle the behaviors in the gray area. So what do we say? How do you take behavior that's in the gray area and communicate to employees that it's not good enough anymore? And here's an example of such a message. To make patient and family-centered care a reality, I am convinced that we need to change some of our behavior. What might have been okay in the past is no longer okay because it impacts the patient and family experience. It's a new day, and I owe it to you to be very clear about what I now expect, and I expect you to join me in living our new culture. So this is a way a manager can say, okay, certain behavior might have been acceptable in the past, and I didn't say anything about it. But now I'm raising the standards, and in the future, you will need to behave in a way that's different from the way we got used to behaving in the past. So we need to start by clarifying the expectation. So how do you raise the bar? Identify those normalized behaviors that are in the gray areas. Not great behaviors, but we've come to accept them. Decide on what we expect and then communicate our changed expectations. Some common normal behaviors that have become acceptable: not showing up to meetings, not meeting deadlines, not answering the phone quickly, rudeness on the phone, not wearing your name badge, being late to meetings, walking past trash that's on the floor, being late, saying I'm too busy while you're making a personal phone call. So we need to clarify what we expect instead of those behaviors and have the courage to not to say to employees, you know, in the future, I hope this is what you'll do, but rather in the future, here's what I expect in terms of your behavior. So how do you communicate higher expectations? And I use this model. In fact, I have worksheets on my desk that I fill out to prepare. This is a great way to communicate expectations effectively. Describe the situation, explain the behavior that's no longer acceptable, and explain why it's no longer acceptable. State clearly your new expectation and identify the benefits for patients, the organization, the team, and the consequences if the person does not engage in that desired behavior. Then communicate a touch of empathy or understanding, because people we work with are good people and they mean well, and there may be, you know, we can be empathic that there might be something in the way of their changing their behavior. And then finally reconfirm the expectation. So here's an example. As a manager, it's important to me that all of my staff introduce themselves to patients. So I've communicated, but I'm finding that people are not introducing themselves consistently. And this bothers patients. They don't know who's taking care of them, and it makes them feel that the employee isn't accountable to them. So here's how I might raise the expectation that from now on, I expect you to introduce yourself consistently to patients. So I would state that expectation. I would describe the situation that I've seen it inconsistently happening, and then I would explain that that's not okay anymore. And I would explain why, because people rely on, they want confidence and trust in the people who's taking care of them. And in order to do that, at the very least, you need to start by introducing yourself and your role. And point out the benefits of the introduction, and communicate a touch of empathy. Like, I know it might be tedious or annoying to have to introduce yourself to each and every patient. Still, from now on, I expect you to do just that consistently. And no matter what we say we expect, over time, what we tolerate becomes the accepted standard. Now, after you make your expectation clear comes coaching, and you need to listen in on employee interactions and provide feedback to people so they are following through on the expectations that you've set. Now, I have a favorite model for coaching employees and giving them performance feedback, and it's called the caring feedback model. Let's say, so you have a behavioral concern, you want to talk to the employee about it. You start with your positive purpose. I know you care, and I want to help you be as effective as you can be, showing you're caring. Then you describe the behavior that bothered you, the specific behavior. I saw you, or I heard you do the following. And then explain the consequences. This is a problem because, and then a touch of empathy. Now, I realize it might be difficult because of such and such. Still, in the future, I expect you to behave in the following way. So it's your purpose, the specific behavior, the consequences, a touch of empathy to show that you're a caring person and you're in good spirits, helping the person, giving them feedback, and then repeat your expectation in a very clear way. So here's an example. Positive purpose. I know you care deeply about your patients, and I want to give you some feedback that I hope will help you make your caring felt even more. I overheard you talking, and this is the behavior. I overheard you talking about a patient in the elevator, and there were visitors in the elevator too. The consequences? I'm concerned that you might have revealed confidential information and also made people wonder if we talk publicly about their loved ones to other people. Then here comes the touch of empathy. Now, I realize it might be hard to find a place where you can talk about a patient privately, especially when you're on the run. And then here comes your expectation again. Still, in the future, I'm asking you to find a way to talk about a patient in private so others don't hear. Maybe say, would you mind stepping out for a minute? I want to discuss something privately about one of our patients. So that's an example of the caring feedback model, which is a very powerful way to give caring feedback that's very specific and helps people reshape their performance to meet higher expectations. Now, of course, the same model works very well with positive feedback. So instead of positive, you say your positive intent, I want you to know I appreciate you. And here's the behavior I heard or noticed. And here's the positive impact that I believe that behavior had. And then a touch of empathy. Now, I realize it's not easy to do this all the time or for every patient. I just want to say thank you. I really appreciate it. So you can see it's the same steps in the caring feedback process. Positive intent, specific behavior, the impact, a touch of empathy, and a thank you. And you can practice this model, for instance, in a leadership meeting. Come up with different situations that managers are facing and help each other prepare caring feedback to provide to employees for each of the situations. Have people develop them and then share their caring feedback statements for these scenarios. So just to recap, key roles in achieving accountability and ownership: commit to and communicate clear, high expectations, provide caring feedback, and hold coaching conversations. Now, a better way to think about accountability is quite simply keeping our promises to the people we serve and to each other. As leaders, we owe it to our staff and we owe it to patients and families to maintain high standards of service and caring. I'll stop there. This is a giant topic. I'll be glad to answer questions about specific situations or just about accountability in general. So thank you for hearing me out, and I welcome your questions.
We will now be starting our 10-minute question and answer segment. You can type in your questions in the chat box on the right side of your screen. While waiting for others to type in their questions, a few questions over here are: why is accountability so hard when it comes to the patient experience?
Well, I think accountability is hard because we know people are working so hard. Our employees are working so hard, and when we see behavior that we think needs to be confronted, some of us feel almost guilty about raising it with them because we know they mean well and they're trying to do their best, and sometimes we feel mean raising it with them. Now others are afraid that it will be, if they raise the issue with people, it will backfire and the person who's hearing the feedback will become demoralized or angry, and that it will create contagious misbehavior. Now these are fears, more than realities, but I think when focusing on the patient experience, the other thing that makes it tough for some people to hold people accountable is that they haven't done enough to get specific about some of those behaviors that are not so objectively definable, like communication behavior. When you confront, sometimes you'll see somebody and you'll think, well, they have a bad attitude and I need to talk to them about it. But if you say to them, I saw your interaction with Mrs. Hope and it looked to me like you didn't show a very good attitude, some employees will say, what do you know about my attitude? You want to see a bad attitude, look at this other person. Or, you're not my psychiatrist. How do you know what's going on inside my head? So, employees confronted with attitude feedback tend to be very defensive. And the fact is, attitude feedback, which frequently is given around patient experience, isn't good enough. We have to get specific on the behavior. It's the behavior that the employee is expected to show. It's not about attitude. It's what we know to be demonstrations of a negative attitude, but what is the behavior that is unacceptable? What is the behavior that we now expect? And that's much less debatable but we have to do the work of defining that behavior. So our feedback does not fall on deaf ears. Any other questions?
What is an effective way of dealing with resistant employees? Example on change. This is from Ms. Leslie Batan.
Resistant employees, for instance, you want to change something and they don't want to do it. I think you need to get very clear on what you expect of them and be willing to repeat it, but repeat it with caring. Now, I call this technique the caring broken record. That means you keep repeating your same bottom line message, but every time you repeat it, you do it with caring. So, if let's say I want people to introduce themselves all the time, and the employee says that's ridiculous, they don't need to know who I am. Well, you could say, it may be that not everyone wants to hear your name. Still, I expect you to introduce yourself to each and every person. And then the person says, crazy, my friend doesn't do it, and you don't say anything. That may be, and that might be frustrating for you. Still, I expect you to introduce yourself to each and every person. Well, and then the employee says, well, who said that's the best practice? Why should they know who I am? Maybe they'll try to, find me at home and I won't be safe. I mean, employees have said pretty strange things. So then the manager says, it may be that you have some concerns about introducing yourself to everyone, but it is the best practice to introduce yourself to each and every person you serve, and that's what I expect of you. So what I'm trying to demonstrate is the caring broken record, where you say your bottom line expectation, you repeat it, but every time you do so, you do it with some empathy, but you don't back down from your core message. And I think that is the most powerful way to deal with employee resistance, is to be understanding and insist that they move past it. So still, you might feel frustrated, you might feel resistant, you might not agree with this. That's the empathy part. Still, here's what we're doing. Here's how we're going to be doing it differently, and I expect you to get on board along with the rest of your team and me. I hope I answered the right question.
Ms. Leslie Baden has a follow-up question. She asks,
okay.
How often do you repeat? What is an acceptable time to follow up and then follow through? Yes.
Well, in the first conversation, I think you repeat it as long as the employee resists. And if you get tired of repeating yourself and you feel like you're not getting anywhere, then say, you know what? I think we've gone as far as we can go. The fact is, just in summary, to be absolutely clear, from now on, here's what I expect. And I am hoping you will go along with this so that we have a very effective team that consistently behaves in this way. And I'll appreciate every effort you make to do that. And if you decide that it's not in your interest to follow this change, please know that you'll be counseled, and it may be determined that you don't suit this job. So you're being clear about what the consequences will be. That basically you need to make this change, and I'll support you. I'm going to model it myself. You do need to make this change, and then to spell out what happens if they don't. Now, how often you have that conversation? I think you have that conversation, and then if they still don't, if they don't change their behavior, you have the conversation the next time you see them not change their behavior. So you might have that conversation once a week for 3 or 4 weeks, and if they still don't change, say, you know what, this is not working. This relationship is not working. Now, here in the United States, mostly managers would go talk with someone in human resources just to get clear on their plan for terminating the employment of the person. But I think the more persistence, the better, when it comes to behavior issues, because as soon as you let them slide, people think the behavior really is negotiable and they don't have to do it. And then everybody gets that message and the standards drop. Other questions or a follow-up question?
We have 2 more questions.
Okay.
The question is, nowadays, almost everyone is on the web and using different mobile apps to check on their health. How can this be maximized as a tool to improve the accountability for the exceptional patient experience?
Well, I think when people are online and they're making comments about their healthcare providers or they're expressing healthcare concerns, this should be used as feedback that we give to employees so that we all learn from what people are doing on the web. We learn more about their needs and concerns. And that is going to make us more responsive and be able to take more initiative to meet their needs. So I see the web and patients' increasing involvement on the web as a terrific opportunity to get much more feedback about what's happening in patients' lives and in their minds so that we can tailor our care and services to them in a much better way.
One question is, regarding recruitment, how can you assess or screen for a caring applicant?
Well, I use a behavioral interviewing process where I will identify the competencies I'm looking for. So in this case, caring, and then ask people to tell a story of a time when they demonstrated it, and to ask them to tell that story in great detail. So you would not say, you know, how caring do you think you are, and what is your evidence? You would not say that because people can just make up answers. But if you ask for a concrete situation when they felt that their caring really showed and ask for the details of that story, people can't really make up a detailed story on the spot. They will have to tell a real story, and from the real story you will find out a lot about whether you recognize that that is actually caring, that they in practice have behaved in a caring way. So it's not what people say they would do, it's hearing what people have done in enough detail so that you can tell whether they were really operating in an emotionally intelligent and caring way. The same as if you were going to examine, you wanted to find out how people would respond to a complaint. You say, think of a time someone made a complaint to you and tell me what was the complaint, and then tell me what you said and then what they said. Tell me the whole story of what happened when that person began with a complaint. You know, how did you handle it? What exactly did you say? How did you feel? How did you follow up? And when you get the details of the story, it is amazing how much you learn about the extent to which the person actually has that competency. And if you want to read more about that approach, it's called behavior interviewing, and my email is on the first slide, and I think you're going to be able to look at the slides online. If you want to email me, I can send you a guide to hiring caring communicators.
One more question.
Okay.
Improving on staff accountability is like resensitizing them to the patient experience. How can you measure the tools used are helping in improving these skills?
Well, I think, you know, there are patient surveys that ask patients, you know, how well did staff listen to you? How well did they address your concerns? How sensitive were they to your pain? How much empathy did they communicate? So a series of questions on a survey that get feedback from patients and possibly their family members. Another powerful way to measure it is through observation, is to do, you know, spot checks. And also I'm very enthusiastic about the power of peer observation, of getting people to buddy up and observe each other on the behaviors and skills that they're supposed to be demonstrating and provide each other with feedback. And you can do that using checklists, so you could tally the results and get quantitative results. But I think the most important thing about measurement is giving feedback for improvement. So observation tools and also surveys, and then also analyzing patient complaints is going to reveal the extent to which there are certain behavior problems going on. So those are the main techniques that come to mind.
Another question.
Okay.
Is there a motivational approach that you can suggest for hospital managers that they can implement to encourage staff to be more accountable regarding the patient experience?
What could I recommend to managers to say to staff to be more accountable?
Yes.
Well, first of all, some people need to be told they're expected to be more accountable, or else. Other people need to hear that the better they communicate with patients, the more they focus on patient-centered care, the more satisfied and gratified they will be coming to work. That it is when we connect with people, we have the impact that drove us into healthcare in the first place. I mean, we want to make a difference. And by focusing on what you can contribute to the exceptional patient experience, you have an opportunity to make the kind of difference that that you wanted to make when you entered the healthcare profession. A lot of us become so busy and task-oriented, it's almost like we forget that what drove us into these jobs frequently is the desire to connect with people and make a difference in their lives. And the focus on the patient experience, if you embrace that as an individual and show that you care about that in your everyday experience and work, you're going to end up happier at work and feeling more proud and more gratified with the work that the contribution you're making. So those are some of the points that I would make.
Okay, so one more question. I think this is the last question we'll be taking in.
Okay.
Her question is, can you share techniques in how to empower millennials?
Well, millennials really need thanks. They aren't very affected by, for instance, long-term rewards. They don't expect them, and they don't really work all that well, but they do expect to be appreciated. And the more powerful appreciation comes from peers. So with millennials, what's really important is to structure activities, for instance, in staff meetings or through like internet postings. Find different structures and methods for getting peers complement each other on the work. Peer feedback is what's so extraordinarily powerful. So lots of appreciation is absolutely critical. And the other thing is millennials especially want to be utterly clear on what they're expected to do. They don't want to have to psych out their manager and read their mind. They want to say, look, tell it as it is, tell it like it is. What am I supposed to be doing? How are you going to be judging me? Give me the whole truth. And, in my experience and in my reading about millennials, thanks, everyday thanks, peer influence, the power of peers, the desire for utter clarity and feedback from their managers is what makes the biggest differences.
Thank you so much for answering all the questions, Ms. Leebov.
My pleasure.
So we will be ending the webinar already. Thank you so much for taking time to join us in our webinar, everyone. We hope that you enjoyed and picked up on many important points. If you have any questions, you can also still email us, and we will be glad to forward them to Ms. Leebov for her to answer for you. We'd love also for you to join us again in our future webinars, which you can find out more from our website, hospitalmanagementasia.com. Thank you so much again, and have a good day ahead.